Hello, my name is Paul Golden. I'm a retired physician. I practiced internal medicine and nephrology here in Modesto, California for 34 years and at UCSF in San Francisco for 5 years before that. I retired 4 years ago, and in those 4 years, I've decided to make my second career writing and speaking about bipolar disorder and major depression disorder. Today I'm going to talk about suicide. As an introduction to that, I'm going to read from a couple of poems by Edna St. Vincent Millay. The first one is entitled Sorrow. I have picked these poems because if you, as I did, read a biography of Edna St. Vincent Millay, she was well before her time, was very eclectic, but led a rather tragic and unhappy life. This poem is entitled Sorrow. Sorrow, like a ceaseless rain, beats upon my heart. People twist and scream in pain. Dawn will find them all still again. This has neither wax nor wane, neither stop nor start. People dress and go to town. I sit in my chair. All my thoughts are slow and brown. Standing up or sitting down, little matters or what gown or what shoes I wear. If you read in those lines, you'll read a very good description of a major depression episode. In her poem entitled The Suicide, she writes, "Curse thee, life, I will live with thee no more. Thou hast mocked me, starved me, beat my body sore, and all for a pledge that was not pledged by me. I have kissed thy crust and eaten sparingly, that I might eat again, and met thy sneers with deprecations and thy blows with tears. I from thy glutted lash glad crawled away, as if spent passion were a holiday. And now I go, nor threat nor easy vow of tardy kindness can avail thee now. With me, whence fear and faith like are flown, lonely I came and I depart alone, and know not where nor unto whom I go, but that thou canst not follow me, I know." I think that describes her, it describes best the way one would feel contemplating suicide. Now I want to talk about the subject of suicide. I was diagnosed with bipolar disorder over 20 years ago. I'm sorry, over 40 years ago, excuse me. It'd be nice if it was just 20 years ago. But in my 20s, during medical school, I had my first episode of major depression. Some years back, I did attempt a serious suicide, which landed me in an acute care hospital for 3 weeks. It was a very impulsive act. I had not planned it. I think from the conception to the acting out of the deed was less than 30 minutes. At the time, I did not feel depressed or manic, but I subsequently found by talking with my psychiatrist that I had features of both and was in the middle of what's called a mixed state, probably the most susceptible to suicide. The Harvard School of Public Health has studied 153 patients who were suicide survivors, serious suicide attempt survivors, and found that in 6 out of 10, from the conception of suicide to the acting commission of the attempt was less than 8 hours, and in 1 in 4, from concept to deed was less than 30 minutes. In 2014, there were greater than 42,000 suicides in this country. That computes to 13 per 100,000 population. In the age group 15 to 34, it is the third largest cause of death behind trauma, which is second, and natural causes, which are third. Overall, it is the 11th leading cause of death of adults in this country. Males outweigh females 4 to 1. Firearms are used in 50% of the cases. Whites, particularly middle-class whites, account for 70% of suicides. Behind that are Native American Indians and Alaskan Indians. It is felt that there are over 500,000 suicide attempts in this country, but that is probably an underestimate because not all hospitals provide emergency room information. I want to mention the American Foundation for Suicide Prevention, or AFSP, which just recently, in 400 communities around the country, had its annual Out of the Darkness Walk for suicide awareness and prevention. In Modesto, I had the opportunity to speak to the approximately 1,000 people who attended the event, and I can relate that on that event last Saturday, the 17th of September, $47,000 were collected for AFSP's programs. I want to mention that I have written 2 books. The first one is an educational book called An Insider's View of Bipolar Disease. And the second one, which will be coming out later this month, that is in the end of September 2016, entitled Bipolar MD, My Life as a Physician with Bipolar Disorder. Thank you, and I'll be seeing you soon on my website, which is www.mdgolden.com, and I can be reached, and I encourage you to reach out to me on my webmail, which is paul@mdgolden.com. Thank you very much.